Hello friends, today we'll see asthma and its homeopathic management. Asthma is a chronic disease. It's an inflammatory disease of the airways of the lung. It's a long-term disease of the lungs. It causes your airways to get inflamed and narrow and makes breathing difficult. The symptoms include wheezing, coughing, chest tightness, and shortness of breath. Causes. There is no definite cause of asthma. Nonetheless, asthma and allergies tend to run in families. Children with allergies can go on to develop asthma. Smoking increases the risk of developing asthma in children. Smoking during pregnancy or smoking around your child may cause asthma. Premature birth is also a big risk factor for developing asthma. Nonetheless, acute asthma is precipitated by some factors. They may include pollen, mold, dust mites, even upper respiratory infections, inhaling cold dry air, gastroesophageal reflux disease, even stress. Asthma is a psychological disease. You may say it's a psychosomatic disease. When I say psychological disease, it means psychological factors may precipitate the acute attacks of asthma. Bronchial asthma is a stress disease. The stresses work through the central nervous system as an inducing factor. They cause disorders in the autonomous nervous system, the endocrine system, and the immune system, and affect the onset and process of asthma. The disease tends to become serious and difficult to cure unless stresses are properly dealt with. It is very important to address the underlying issue of stress because it may be like a maintaining cause for the acute attack or even the chronic attack. It may work as a maintaining factor. The psychological stressors include anxiety, fear, anger, hatred, inferiority complex, guilt, and the psychological stimuli that cause these emotions. Social stresses may include school entrance examination, employment, reassignment, promotion, retirement, marriage, divorce, even housing loan and legal problems may all contribute to the pathology or even the attacks of asthma. The treatment, like any other disease, asthma is very much treatable with homeopathy. It's a reversible disease. Asthma is called as a reversible disease. The idea is to find a simillimum of the case which covers physical as well as psychological aspect of the individual. This will offer a deeper prospect of healing. The approach is to find the acute remedy which covers the current episode of acute asthma, followed by a chronic remedy. The chronic remedy should cover the constitutional aspect of the patient. And the intercurrent remedy. Intercurrent remedy is very important for a long-term approach or total cure of asthma. It enhances or completes the action of remedies. The top remedies for asthma include arsenic album, spongia, antimonium tartaricum, ipecac, sambucus, carboveg, senega, rosera. There are many other remedies that are indicated for asthma. We'll see all these 8 remedies first. First is arsenic album. Arsenic album has a suffocative cough. The cough is worse at midnight. The patient is unable to lie down for fear of suffocation. In arsenic album, the skin complaints alternates with skin rash and eczema. The atopicity, or we may say atopic dermatitis and asthma, usually patient may present with both in arsenic cases, or currently he may be only having a respiratory complaints, and if you go on to find in the history that there was skin complaint and they alternate with each other, the skin complaint and respiratory complaint, they alternate with each other. Arsenic album is a good remedy for that. The arsenic patient is very restless, mentally very restless, but physically he is too weak to move. He wants to change places continuously. He feels that the disease is incurable. It is useless to take medicine. This is a feeling of arsenic album. He has great thirst for cold water, drinks often, but very little at a time. Second remedy we'll see is spongia. Spongia has a dry cough. It has a deep barking or hacking type of cough. The type is barking or hacking type of cough. There's extreme dryness of air passages. Keynote red line symptom of spongia is extreme dryness of air passages. Warm drinks give relief to patient of spongia. Aggravation by lying down and aggravation by sweet. Even the throat complaints or sore throat is caused by sweet. Bending head backwards ameliorate. Every mental excitement increases the cough. Now we'll see antimonium tartaricum. The patient has excessive rattling cough. It feels that the chest is full of expectoration, but it is raised with very much difficulty. Suffocation worsens on lying down. All this mucus is a good media for infection. So the patient may come up with asthma with pneumonia. The patient has white coating, halitosis, foul odor from mouth, thirstless, drowsy. This is typical of entim tart. Drowsy. The patient is drowsy and thirstless. Great sleepiness or irresistible inclination to sleep. With all complaints of entim tart, you can see this, drowsy and thirstless. Ipecac. Ipecac has a difficult breathing from least exercise. The patient is very weak of ipecac. Gasping for air. Child may become blue and stiff during attack. Asthma with vomiting. This is how we differentiate ipecac with others. Asthma with vomiting. Continuous nausea. Even vomiting does not give relief to the patient of ipecac. There is continuous nausea. Nausea with profuse salivation. Vomiting of white glary mucus in large quantities without relief. Sambucus. Sambucus has childhood asthma, night asthma in children, waking child from sleep, dry cough without wheezing, hurried respiration, asthma without wheezing, sambucus, childhood asthma, sambucus, hurried respiration. Carbovec, wonderful remedy for patient with asthma in elderly. There is burning pain in chest, asthma in elderly. Entim tart is also good remedy. The phlegm of Carbovec is mainly yellow or pus-like, sour, salty or putrid taste. Cough gets worse in the evening. Aggravation when one goes from warm place to cold place. There is decrease of oxygen level. Blue lips. The patient has blue lips in Carbovec. Wants to be continuously fanned. This is Carbovec. We have seen about the causes or the cause, the GERD. GERD causes acute attack of asthma. So if the patient presents with flatulency or distension of abdomen, you can think of asthma. You can think of Carbovec. The patient has weak digestion. Even simplest food disagrees. There is excessive accumulation of gas in stomach and intestines. Now, Seneca. In Seneca, wheeze and cough end in a sneeze. Even if the patient does not have asthma, if you find this symptom, cough ending in a sneeze, you can think of Seneca. Patient has rattling, difficulty in raising mucus from chest. The expectorate is very tough and profuse. Operation, feel of heaviness in chest. Along with there is pain in back. Drosera, dry irritating cough. Drosera and spongia, they have dry cough. Their throat is dry. The paroxysm of cough follow each other rapidly in Drosera. Talking aggravates. There is scraping sensation in throat. There is continuous irritation in throat in the patient of Drosera. The sensation of feather in larynx. Exciting cough. The voice is affected in patients of Drosera. There is deep, toneless, cracked voice. Even if the patient wants to speak, he has to exert in order to speak. The efficacy of homeopathy treatment for asthma has similarly been proven through clinical research. Homeopathic treatment for asthma focuses on bringing down the intensity, frequency, and duration of attacks, increasing the disease-free period and minimizing the use of chemical drug. Asthma is very much treatable with homeopathy. First, we decrease the frequency of attacks, then we give an intercurrent remedy, and finally a chronic remedy. Chronic remedy, the total treatment period for cure may go as long as to 2 or 3 years or even more than that. in order to say that patient is cured. Thank you.